Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert here today with Dr. Millicent Rovelo, looking fresh for coming just out of the operating room. How are you doing?
I'm doing pretty well. I'm feeling a little fresh. Actually, no, I'm feeling a little stanky, actually.
But you look fresh.
As one does after 8 hours.
And you're across the table, so who cares?
Exactly. I can be as stanky as I want.
That's right. You were operating all day.
I was operating all day, and we had to get some podcasts in because you've decided to just not be in town anymore ever this month.
Listen,
So
I got kids.
I know.
And they are
busy.
very demanding. So, I mean, I went to pick up one kid in Europe bring her back from college.
Yes.
And now my daughter has made the state finals in her tennis championship. So hopefully she'll make it past the first round because we're all going.
It doesn't matter. She made championships.
I know. It's
That's
so
amazing.
great. We're really praying for her, though. She's a beast, and she's playing really well. So fingers crossed. But, yeah, I have to go. I cannot not see the state championships.
Yes.
You have to see that.
And so we squeeze these podcasts in where we can after days of surgery and office and procedures. And we show up because, Dr. Calvert, I have a question for you.
Yes.
It's a very important question, actually.
What's for lunch?
No, that's the number 2 question.
Oh, okay.
The number 1 question is it okay to have plastic surgery?
Oh, man. Yes, of course it's okay.
course.
But we get this question all the time about I don't want people to know. And it is changing. And that's why this question is a great discussion. Is it okay to have plastic surgery?
Yes, and what caused us to think about this one and to bring it up is because we get these questions in our inboxes from different magazines and journals and news places, and every single day there's a question about need a plastic surgeon to comment on whether so-and-so celebrity has had plastic surgery. Need a plastic surgeon to comment on whether so-and-so has had any work done. And it's every single day, and it's clearly working as clickbait. People clearly want to hear these things.
I click on them.
Everybody wants to know
It works.
who's had plastic surgery.
Totally. It works.
And that's fine. I mean, that's literally what we do. It's our jobs. And it used to be that, you would speculate about it, but you never really admitted whether or not you had plastic surgery. But I think things are changing. I think we speculate, and people are becoming more forthright about coming out and admitting to it. But there is still in the background that judgy attitude towards plastic surgery. Because the reason it's clickbait is because people want to secretly judge whether or not that person had plastic surgery.
Yeah, they want to judge. They want to see it's a lot.
It's so many.
There's so many things because people do want to think of themselves being, someone who could have plastic surgery. Ooh, could I do that? Could I have that done? And then there are other people who want to hate on it. There are definitely the trolls and the haters.
Ugh,
Lots of them.
Go back
Lots
to your bridge. The trolls.
I know. That's I mean, it's really tough because I do think that it is changing. People are more willing to talk about it.
Especially with social media. Everybody wants to talk about their journey and what they did. And so I think that has helped normalize the topic to some degree.
Yeah, I mean, and it depends on what it is and who it is. I can tell you my patients do not want to be identified, and they don't want people to know that they had plastic surgery. I have a group of patients that is really they want the natural look. They don't want to see the scars. They don't want people to know they had a facelift. They don't want to know they had a nose job. They don't want to know that they had, the breast implant thing, okay. I want them to look natural. No, you don't.
No, you don't.
You want them to look.
Do you know what natural breasts look like?
Let's go to the videotape on that. No, you don't want them to have natural breasts. You want to have naturally augmented looking breasts that are obviously to any of us, they're implants.
Right.
If you're 55 years old and your breasts are, up high and standing at attention and have great volume, the odds are something's been done to get them there. They don't do that naturally. Naturally, they do something different.
Yeah.
They head south. They head for the floor.
Yep.
And that's what natural breasts look like. So these questions about is it okay to have plastic surgery. It's okay with us. We love doing plastic surgery.
Obviously.
We're cool with it.
Yes.
But for the public, I kind of wish that the people in the public eye would own it a little bit more, you know? Like, we'll just say like, oh yeah, I did my facelift. And like I've always said, I've seen my patients on the red carpet lots of times. Like every time that there's some big thing, there's a patient on the red carpet and they go through, oh, who are you wearing? Oh, I've got these and my shoes are by Armani and blah, 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 and this, that, and the other thing. And I want them to add, and my facelift was by J. Calvert and my rhinoplasty was by J. Calvert. You know, I want them to say it, like put it out there. Say like, I don't look like this naturally. This was something that was done really well over time. And it just, it's got to get there. It's
never gonna happen.
I know it's going to happen. It's going to happen in my lifetime. I can't wait.
Yeah. Okay.
You don't think so?
Never. Not in your lifetime.
Because?
Because people don't want to own up to it. They just don't want to. Because there's also this underbelly stigma of the trolls and the haters and the people that are going to judge. So another thing too, which I think we need to get past, because this drives me nuts. I actually got one a few days ago or last week, like, did Hillary Clinton have a facelift?
Yeah,
and so
of course.
I go, and well, I don't know, because I went to go look at the photo in question, and I was like,
if she did,
if she got a facelift, it's either been a little while or someone forgot about the neck. But then, like, see people go on to comment about whether or not she had plastic surgery, and they're like, oh, she's clearly had the fillers and the Botox and this. Sure, her skin looks beautiful. It looks plumped. It looks filled out. It is a very smooth canvas. Like, I will say all those things. But can we stop saying that fillers and Botox are the equivalent of plastic surgery? People love to comment on whether or not someone's had fillers or Botox done. It's like, I think at this point in our lives, Botox can be considered the equivalent of getting your hair or your nails done. Not to the extent of like, you have to have the skill to be able to do it, and obviously it's more expensive and it's more invasive, but it's kind of part of the basic upkeep. And nobody criticizes anybody for getting their hair or their nails done. So like, why does Botox still have a stigma about it? Like, come on,
That's
it's
true.
2025.
They don't have curtains around the hairdresser's chair. No. Like, oh, don't let anybody see it. Oh, you're going to need to sign this HIPAA form to get your hair done. No, people sit in the middle of the open and you get your hair done.
And it's just a thing. It's
like you get haircuts and
part of maintenance.
You know, they put dye in your hair and like.
But God forbid you get Botox. Like, come on, that's like in the water. It should be in the water.
You're right. That is quotable, Dr. Rovelo. I think that is quotable. Is like getting your hair and nails done and it should be. So, you know, why not just do it in the salons? Like we just have like sit down, you know.
Oh my gosh, that'd be brilliant.
Oh,
Get a med spa with like an open facing like thing.
Listen, my dentist is open, and my dentist takes care of, you know, hands down some of the biggest A-list name celebrities on the planet, and he's got an open office. Like there's no like, you know, so and so's coming in or whatever. Don't let them see your teeth getting cleaned. You know, like,
or even if you're getting whitened or getting veneers, people are happy to like own up to that all the time.
Oh, just go into his office. He has the wall. I mean, this is John Marashi, the greatest dentist as far as I can tell, and he has, you know, signed picture from Matthew McConaughey, from, you know, Jada Pinkett Smith, from, you know, Renee Zellweger. Like, it's just down the entire row of every celebrity you could think of. John, thanks for the great teeth. You know, and then he's got him on his Instagram sitting there smiling, Tom Hanks with a Woody doll. Like they love owning up to it that they had their teeth done with, you know, this amazing dentist, you know.
So like, but why can't we admit to Botox?
Where are we for that? Come on, people.
But yeah, so that's where we are. There is still like the celebrities who try to hide or not own up to what they've had done. And then I think you have the celebrities that just because of their own ethos and you know what they believe and what they want, just don't want to have work done. Totally fine. You age how you want to age. But I also think that there are some celebrities that are kind of scared to have work done because they don't want to get their fans like hating on them. It's like, you kind of need a facelift. Like, you'd look so great if you had one. And maybe they just don't want one. Totally fine. But maybe they're scared to do it because they're worried about the backlash. So I don't know that we have become that evolved. And then we also have the patients who, as you alluded to, don't want their friends or family members, and I get this a lot, their mothers, to know that they've had a tummy tuck or they've had a breast job or they had something done because they're so worried about how judgy their mothers are going to be. And it's like, can we just move past the judging? Because if you are going to judge someone who had plastic surgery, God forbid, to look better or to feel better about themselves, you are literally judging. So how does that make you any better than the person that decided to do something? Like,
it doesn't. And this is the thing is I always say that, if you stop for a minute and think about what we do in aesthetic plastic surgery, we do things for ourselves to make us feel better about how we look, how we feel, whatever it is, gives us more confidence. So how is it that that's a problem? Because think about it, you do go get your hair cut. You do get your nails done. You do, watch your diet, eat better, work out, try to look your best, put on clothes that flatter you.
Right.
We do everyone
Take care
does
of your
them.
Teeth.
Everyone does that.
Yeah.
Like it's not, and maybe that's not everyone. Maybe there are people that, just could care less.
The average
but the average person on earth, who, gets up in the morning to go to work or go to school or whatever, they're doing things to try to make themselves look better and feel better for themselves. It's not for others. They say it as, oh, I want to look good for so-and-so. No, you want to look good for you so that you feel confident, you feel comfortable. And there's nothing wrong with that. There's nothing wrong with trying to make yourself look better and feel better for you. And that's what plastic surgery really is. You should never have plastic surgery for somebody else. You should have plastic surgery because it's something you want to do for you to feel better or to like something better or to look better, whatever it is that you're thinking, it's for you as the individual. And it, boy, does it work. I mean, when things are good, it's really good. And when they're not good, then, we get bad Yelp reviews. That's the bottom line.
I'm going to get those no matter what. Even with the great work.
It's funny, and speaking of bad Yelp reviews, I got one recently that was like, my nose was crooked after surgery, da-da-da-da-da, and, it's not able to get it straight, and, I'm not happy. And it was like actually a decent 1-star review, which I didn't really argue with her because something happened. It scarred in kind of weird. Now, she started off very crooked and very strange to begin with, but her nose is 562 times better than where she started. And it's a little crooked. And you can see that if she did a 3/4 view or something like that, it would look better from one side or the other, which is the case for almost everybody on earth.
Right.
But she felt like, and I was like, well, I can work with you. I'll get it straight or whatever. And in the meantime, I just published this enormous video on straightening the crooked nose with a crooked tip and how to do it. Like it's all there for like anybody to watch. And I said, well, this is what we need to do because for some reason you healed this way. I wasn't going to charge or anything. I was going to just, do the job that needed to be done. But there's the 1-star review. And she doesn't look bad at all. She looks great. So that's what happens. I told you I had a 1-star review that got me so many patients because she did, like anybody should, they should show every view of their nose and you want to judge, let everybody judge. Don't show the one view that's like, my nose is crooked.
Right.
Like somebody's nose is going to be crooked. I think everybody's nose is
everybody's
crooked.
Nose is a little crooked. Yeah, our faces are crooked, by the way.
Period, end of story.
I know.
So that's the thing. But the bottom line is she still looked better. She still, and that would be, if I could interview her again, which I won't, I would say, okay, so your tip is off center by 2 millimeters. And yes, on your 3/4 view, it's going to look better from one side or the other. I get that. Well, what about how you look? Like it's strikingly better. She went from a big hump to a twisted, all those things. And it's so much better. But sometimes people just can't be satisfied. They just can't. They won't allow it to sink in that it is better.
So much better.
It is so much better. And it's just, and anybody you ask, if you showed the before and after, they'd be like, oh my God, home run.
I think people do forget where they started.
Totally.
So they look in the mirror and they forget where they started from. They just see where they are now, and then they look at all the faults on what they see now.
Right.
And they forget, what it was like before. So it is really easy to do. So if showing people their befores and afters, sometimes they can go, oh.
Oh, I know. Sometimes they'll be like, wait, I didn't look like that. That's not me. I swear to God, I was like, no, that was you. Like, that's your picture. Like, here it is.
I don't Photoshop the befores.
No, there's no photoshopping here. This is what you look like. I walked around like that? Yes, you did. Yeah, then you were fine. You just, now you look better. And yes, can every single plastic surgery operation have something about it be better?
Of course.
100%. Every operation done by anybody.
Yes.
And bring me a plastic surgeon here who says, oh, no, I get it right every freaking time. No, that's not what anybody says. Surgery is imperfect. But it can be monumental and a life-altering event that can really have an incredible impact, and that's why it is okay to have plastic surgery. You do have to know about the risks. You do have to know about what can happen, what the downsides are. And you kind of have to have a sense of humor about it because, things come up with surgery. They always.
Yeah. It's not always a straight line. Sometimes the recovery goes a little bit off track. There's a little bit of a detour. And somebody might find out that you had plastic surgery. These are all, you have to have a sense of humor about it. You have to be like, yeah, so I did this.
I mean, remember we had Dubrow in here. He didn't even tell me how much pain he was having after surgery.
Yeah.
He didn't even tell me. Like, he's a freaking plastic surgeon.
Well, because he knew. He was like, well, what's he going to do about it?
But he was in agony. Like, he was in so much pain, which was weird because, he had a really uneventful operation. Like, I mean, you could see it. He went through it. He did great. And now it's like he's got and he said, I just didn't want to bother you. And, but it is one of those things that's like everybody has a different experience of it. Everybody heals differently. You can do 20 facelifts in a row and not have any problems with scars, and then somebody gets like a keloid around their ear. These things come up, and as I tell all my patients, you'll find out how good a surgeon I am when things aren't right. Because, like, if it goes right, you're going to be like, oh, the guy's a master. It's great. But when things aren't right, that's when your surgeon rolls up their sleeve and takes care of it and gets to work and makes it better because things come up in all cases with plastic surgery, and you just have to understand that healing these operations is variable. And I do rhinoplasty pretty much the same way every time. Why one nose come out crooked out of the last 500 I've done? I don't know. I don't know what happened. I did it right. I did all the things correctly. I put the grafts in the right place. And then sometimes there's a low-grade infection that nobody really picks up on, or they don't come in for a while. Like, things happen.
Yeah.
So you got to be ready and willing to do all that. But it is okay to have plastic surgery. And it is okay to tell your friends about it. And I think it's okay to tell on the red carpet who did your operation. I think it's totally okay.
And I think it's okay to tell your mom.
It's definitely okay to tell your mom.
Maybe not maybe not some moms.
Maybe not some moms.
Maybe not some moms.
Maybe not some moms, but most moms.
And can we just, blanket statement, people out there are all across the world, can we just stop with the hating of the plastic surgery and the people that had it?
I'm going to answer that for you. No, they need it. People need to feel good about themselves however they can. And, the trolling and the hating it's awesome almost. It's like, what do you do in your life that you have time to do this? Like,
right?
How little is happening in your world that you have time to get on there and write something like that? It's like, it's impressive. It's mind blowing that's part, and Dubrow, Terry and Heather both say this. Don't look at the comments.
No.
Just don't look at the comments.
Because it's going to be somebody.
Don't, it just move on.
Yeah.
It's okay. They're like,
yeah, they have some comments.
They get the comments. Yeah. Our little podcast is a little different, but it is interesting. And speaking of comments, we had a comment recently. Didn't we want to bring that up?
Yes. So we, and by the way, we do love comments and feedback. So however you want to leave them.
Trolls or not, we'll take whatever.
Yeah, we'll just tell you to go back under your bridge if you troll us. But no plastic surgery for you, troll.
That's right.
But we got a comment from our most recent Threadlift podcast. A viewer commented on her own Threadlift experience, and she basically kind of said more or less what we said on the show as well, which is that she had the Threadlift done. It was a little more painful than she expected. The healing took a little bit longer than she expected. It accomplished her short-term goal, which was to look better for a certain event. But then it went away after 6 to 9 months, and she felt like she looked even older than when she started, and she would never do it again.
So there you have it.
That's pretty much That's pretty much what we said on the podcast.
Yeah.
But we appreciate the feedback and the fact that, people are willing to share their stories and experiences.
I don't think I'm going to have a thread lift.
No, we've established that that's not for you.
Damn it.
Sorry.
But if you have had a thread lift and it starts to go away, I think at some point you gotta
Well, it will go
see
away.
the plastic surgeon.
I mean,
that's the
what
truth.
it does.
I know. Well, this was good. It is. So our answer is it is okay to have plastic
It is
surgery,
okay.
and we think you should share it as much as you feel comfortable with. Obviously, I know my patients won't. I'm sure about that. The ones that will, thank you. I really appreciate it. I appreciate you being on my Instagram and my TikTok and all that. I really do appreciate it to the patients that have, shared their journey. And I always thank them. And I say, it's great that you're here and you talk about it.
And it's
Because
great for other patients,
it
too. I mean,
is.
I will definitely have patients who are having smooth recoveries. I'll have patients that are having bumpy recoveries. And they'll go online and they'll look up the recovery for X procedure. Sometimes it's a bit of a rabbit hole. I'll go, I'm 4 weeks and why am I not here yet? But sometimes they also get stories where they're like, oh, I'm actually where I'm supposed to be in this process. Or, oh, that person had it a lot. I'm actually doing okay. So I think to a small degree, looking at other people's stories can be of some benefit if you don't spiral down the rabbit hole of recoveries.
Well, and there you have it. Anything else, Dr. Rovelo?
No, that's it.
It's okay to have plastic
It's okay.
surgery. It's okay
to have plastic surgery.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.